Bienvenue dans Topik Conversation et dans mardi nous traitons la santé et dans Topik Paris Mondi Bonnet nous pour causer un petit peu la santé la bouche lui-même avec diabète bien sûr et aujourd'hui mon invité des docteurs des dentistes qui nous aident pour nous causer un petit peu ça c'est les autres sorties dans le ministère de la santé et d'ailleurs ils ont première fois ici de bonjour c'est là pour tout ça les temps qu'ils sont là alors nous pour commencer par je pour introduire l'école mais par l'habitude dialogue avec nous faire sa conversation avec nous envoyer questions si questions qui on a et les mon invités sont capables de répondre toutes questions pertinentes ça c'est qui nous peut cause là au capable voler en créole au capable voler en anglais à cause un petit peu la bon matin nous cause un petit peu fort anglais mais seulement autant possible qui nous capable emmener en créole nous pour emmener en créole alors c'est mon invité Dr. Abhisheka morning.
Good morning.
Comment ça va?
Bien, merci.
Bien fait la nuit hier soir, passe bien?
It was okay.
It was okay.
Yes.
Et il est accompagné aujourd'hui par Dr. Jerry. Docteur, bonjour.
Bonjour, bonjour.
Comment ça va?
Bien, merci, ma'am.
Cause que on l'aime tigil?
Chicken.
Chicken. We speak in English?
Yes, that'll be better.
That would be better. So, can you introduce yourself to us?
Yes, my name is Dr. J.Mammen, and I'm a specialist for gums and bones. So we are called periodontists. So basically, we deal with all the issues that you have within your gums and the bones surrounding your tooth. And we are a specialist group. We have just started the unit around 2 years back, and there are 2 of us now working at Yellow Roof.
Only 2 of you?
Yes, only 2 of us.
How long have you been in sessions?
I have been here for 6 years.
6 years?
But the unit has been started in the last 2 years.
Only in the last 2 years?
Yes.
Why did you decide to introduce the unit?
So basically, if you see in Seychelles, before I was working in a district clinic. So at that time, we have seen enough and more cases of periodontitis, that is the gum diseases. And eventually, there was a plan to start the unit. So once we had one more specialist who has come in, the department was started. And then so we can cater for more of these patients who require the specialist treatment. So in last 2 years, we have been effectively seeing a good amount of patients who require this treatment and given successful treatment for most of them.
What will you say now after 2 years?
Sorry?
What will you say now after the 2 years?
We're very happy that we got this opportunity to work as this unit because if you see the gum disease is not patients don't give so many issues, or what you can say is that they'll not come up with the problems as such because it's simple little bit of gum bleedings and maybe slight mobility of the teeth, and they don't go to the dentist just like when they go for a tooth pain because it's not painful and people don't tend to go, and when by the time they come to us, yes, it's very late. The teeth are very mobile and then it's even out of our hands. So now we are educating them, saying that even if you have bleeding gums or even slight mobility of the teeth, go and show the dentist, because the primary level the dentists do see these patients. We have the hygienist group there, or the special another group of cadres that work for specifically for these kind of problems, and once they diagnose these cases which cannot be managed at their level, then they refer it to us for specialist treatment. And for the past 2 years, I think we are running very well.
Et bien si nous peut cause la santé la bouche, gencive, paripédie, gamme, et il y a une unité qui nous veille dans des ans présents, juste pour faciliter un petit peu quelque chose. Et Dr. Abhisheka, cause un petit peu créole.
And Chigit.
Introduis-nous.
I'm Dr. Abhisheka. I've been working here for about 6 to 7 years now. Next year will be 7 years. I've been working as a dental public health specialist for the last 2 years. Mon site Machin commence dans my district clinics, Machin commence to pralen la jig, and then I've moved to Mahe, and then I've moved to my specialty specifically. So yeah.
Ou spécialisé dans quoi ça veut dire?
Dental public health has a lot to do with prevention, has a lot to do with population level concepts. In the clinics, we tend to individualize it. So we deal with patients one-on-one, and we do the curative care, the treatment, right? But when it comes to dental public health, you have a tendency to look population level, to look at what are the discrepancies that patients are facing that you can change at a population level. You can change it on how people in general can access services, can benefit, can look for cost-effective ways to manage and treat any dental problems especially.
So you both based at the Yellow Roof?
Yes.
No more in the districts?
No.
But tell me about in the Yellow Roof. How is it? On appointments or special cases to go and see the specialist?
In Yellow Roof, yes, it is on appointment basis. So patients that are seen at the primary health centers, if the dentist or the dental hygienist,
They are referred.
yes, if they see that they require a specialist attention, they send a referral to us, and most probably we give the appointment on the same day or within a week's time, depending upon the specialty. So since ours is a new specialty, we have a shorter waiting period, but specialist units which have been there for a longer time, they have a little more longer waiting period. And the patients are booked, and then the day of their appointment, they come in and we see and do a detailed checkup, and then we continue with the treatment for them.
How many patients you see in a day?
Again, it's from the clinical point of view. Depending upon the specialty, it varies. In our unit, we see on an average of 9 to 10 patients per day.
Per day.
Yeah, but that will include detailed examinations. Everything will be done in detail, including X-rays and everything.
Nous causons un petit peu la santé, la bouche, les gencives, gum. We're talking about gum. Is it alarming in sessions?
Yes, if you see, we have a large group of patients or people who have gum diseases. But like I said, most of the people don't come forward because there's no pain. That is the biggest problem with gum diseases. There's no pain, so nobody comes forward, and then they come at a stage when
Everybody's afraid of the dentist.
Exactly. But
Yes.
the treatment that we provide is not at all. It's mostly pain-free. It's mostly pain-free. So if they come at a very early stage, we can actually prevent patients from losing their tooth and being edentulous. So you can have your natural teeth for a longer period of time, whereby you can enjoy all the good quality of life. Yeah.
So if I'm a patient, I have to come in for my checkup or to see a dentist like what, 2 times a year to prevent all these things?
Yes, at least a checkup every 6 months.
Every 6 months?
Every 6 months. For us, it changes because once we diagnose a patient with gum diseases, the criteria changes. If we see the patients are more prone to destruction, we call them every 3 months. Some of the patients, we call them every month. That's based on how severe the disease is.
Justement, Dr. Abhisheka et Dr. Jerry nous amènent des 3 portraits pour partager avec nous la santé de la bouche avec diabète qui nous on peut voir la télévision. Et Dr. Abhisheka, ça est là?
This is called the fisher tongue. Surtout ban patient diabète nous connaît zot la bouche sec. Zot on a tendance ki zot la bouche sec. So je vois pour dire que zot la langue etc. they feel it's a little bit leathery. So it has a lot to do with the microvasculature. So it tends to go on a
Quoi que cause ça?
It's more of at a cellular level, right? So diabetes can cause complications of microvasculature. So the blood vessels tend to be affected. So when you have that, you tend to have these kind of problems like xerostomia. But the most common, like the earliest complication that you see in diabetic patients is periodontitis, right? Which is why Dr. Jerry is here to talk about that. And it's, when you look internationally, they say is the 6th complication of diabetes.
6, huh?
Yes, and it's one of the earliest complications. For us dentists, a lot of times we see periodontitis or gum problems in patients. And
What do you observe?
You observe bleeding in the gums, or you see the tooth is mobile, or you see that there is a loss of bone. When you take an X-ray, you see loss of bone around the tooth. So when you see those problems, you have a tendency to realize that these are periodontal problems, and then you start probing the patient. Do you have any? Does your family have a history of diabetes? You know, and have you ever gotten tested for diabetes? And some of them don't know. When we check in the mouth and we see these problems. And when we do get tested, we do the test, it does come back as they have some form
history
of diabetes, at least pre-diabetic, or even they've already developed it, they just don't know about it. So that's when we start working in collaboration with the medical professionals to diagnose and treat the patient and put them on a normal regimen.
But it can be treated.
The gum diseases, yes, that's why we are here.
Everything in the mouth is preventable.
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 But now, since we are talking about gum diseases, we call them as periodontal diseases. And if you want to classify them in a simple way, it's two basic types. You have gum inflammation called gingivitis, and inflammation within the supporting structures, that's the structures that support the tooth. That's called periodontitis. Gingivitis is completely reversible. That means if a patient comes with swollen gums, bleeding gums, if you give the right treatment, it can be reversed back completely. But if you are talking about periodontitis, whereby your bone supporting the tooth, the fibers that are attaching your tooth to the bone, if they are destroyed, then it's not completely reversible.
Really?
Yes. Already the loss has happened. Now what we try is manage that more loss doesn't occur there. We have regenerative procedures.
You can manage?
Yes, we can manage it, and we are managing a lot of cases. And we have regenerative procedures also, where we do grafting, bone grafting, and there are procedures that we do whereby we increase the level of the bone also for the patients. But it's, again, case specific.
Specific cases.
Yes.
Is there, or has it happened a moment that the patient has to lose the teeth?
Oh yes, there are cases when, that's what I said, the problem lies when the patient comes to us at a very late stage, when it becomes severe periodontitis. In those cases, the extreme mobile teeth, we cannot do any magic there. So in those cases, when it is very mobile, we advise the patient that it is better you remove that tooth,
that tooth,
because otherwise the infection is persistent there, and you're going to destroy the bone all around it and even the adjacent teeth. So get rid of the tooth which has a very poor prognosis, and at least we'll try to save the remaining ones. Later, the patient can go for a denture.
Et pour vous qui demande nous au panto comprend si vous faites besoin de nous justement ou qui demande nous côté autres basés tous les deux autres basés dans Yellow Roof qui nous dit 3 zones en ville tous les deux autres basés là-bas pour qui demande nous sa question et si nous pour regarder les autres questions doctors, we have questions coming in. What are the symptoms of gum diseases?
Okay. So like I said, the first symptom which the patient experiences will be bleeding gums. So while brushing the teeth, while chewing onto an apple, you will see blood stains on the apple. That's the first sign a patient should notice. Then while brushing, again, you will see a little bit of blood here and there. Here. That is the first sign that you should notice that, okay, something is wrong with my gums and I need to visit.
It's not normal.
It's not normal. You should not have blood in your mouth. So that is not normal, and that I should see the dentist. And now as we progress more and more, from bleeding, there'll be swelling gums. The gums will be swollen here and there. From there, you go a little more, you will have loose teeth.
But you should report the moment you see that.
Yes. See, again, I said, what I said is this, because there's no pain, most of the
this is the problem. There's no pain.
People ignore it.
You don't report.
Ignore it. And like I said, many patients, I feel like if you had come to me around 2 years back, we could have done much better work. So it's that early detection, early diagnosis, early reporting to a dentist, every 6 months visit to a dentist, very, very important.
Ça veut dire que c'est important qu'il nous prenne un petit peu plus précaution pour nous, la santé de la bouche contre les dents. Il concerne early detection, prevention is better than qu'il nous bien si qui nous perdit les dents, on connaît perdit les dents comme si pas comme si pour les poser on est tout dans les dents ou ça comme ça nous prendre un petit peu plus précaution contre nous les dents y concernent et bien si dans les autres questions qu'il y en a we have talked about symptoms. Now what are the treatments for periodontitis?
Okay, so the treatment for gum diseases. Okay, the first and the foremost thing which we sit with our patient and explain is brushing techniques, flossing, and use of interdental brushes. So this is most important thing. It should start at the patient level. Even if we do all the surgeries, all the cleaning, and if the patient doesn't maintain or if doesn't keep a good oral hygiene, the whole problem starts again. So the most important at the first level or the first thing that a patient should do is good oral hygiene. That is proper brushing, flossing, and then use of interdental brushes. Once that is done, then we move to something known as a phase 1 therapy, whereby we do a cleaning. like normally we say cleaning, we do the same thing, but we do a little bit of what we call a deep cleaning. And since the roots are exposed, we do the cleaning of the roots. We call it root planing. We go through all those steps, and in patients with severe infections where there is abscesses and lymph node enlargements, we give them some antibiotics to control that. And then we assess the patient after a period of 4 to 6 weeks. And then we do something known as pocket marking. So this, we measure the depth of the pocket where the bone loss has occurred. And if we deem that it is necessary that something has to be done based on certain parameters, we move to the phase 2, what we call the surgical phase, whereby we do surgery. Like I said before, regenerative surgeries.
That was phase 1?
No, phase 2. That is after the phase 1, after the cleaning is done.
After the cleaning is done.
Yeah, then we wait for 4 to 6 weeks, and then we decide, based on certain parameters, we decide whether the surgery is required for that patient or not. Then there are certain cases where patient come with big swellings in the mouth. In those cases, the treatment plan is little different because that swelling will impede from proper brushing. Imagine having a big mass in the front teeth. You will not be able to put your brush there. So in those cases, after an initial phase, we do a removal of that mass from there. Normally, we send it for a biopsy just to make sure that there's nothing else wrong with it. So do a histopathology and then get it done. So aesthetically also, meaning looking at it also, it will be very nice.
Wow. OK. Bon, dans les autres questions qui nous peut gagner, on a une question sortie côté Rolly, bonjour. Rolly, il dit bonjour Carol avec ou des spécialistes. Rolly say good morning to you all. And he said, si mon incisor est bougé et il pas fait mal, est-ce qu'il est capable de caler ou bien il besoin remettre en ordre? Incisor.
Yes.
If it move, but it doesn't have any pain.
It depends on what is causing that mobility in that incisor, right? It can be moving. There's so many reasons why it could have happened. So we need to do a proper investigation to assess the situation and then decide what to do with it. And unless we see that patient, I can't tell you what we can do. There are so many treatment options that we can explore, but I can't say at this point in time without investigative procedures.
He has to report.
Yes.
He has to report. Yes. Just because there's no pain, again, just because there's no pain, there's nothing wrong. Souvent, fois ici, nous sommes patients. Et Dieu, comme ça, ben, on n'a pas aucun problème avec mon les dents. Therefore, on n'a pas besoin de dentiste. Je vais au dentiste, je vais à douleur. Présent, je vais au dentiste, je vais 6 heures du matin pour gagner un premier pas dentiste. Je remplis sa banque au dentiste. Right? Nous pouvons essayer de décourager ça. If you have real emergencies qui rapportent au dentiste first thing in the morning, everything else you can take an appointment to see the dentist, the dental therapist, and then the dental hygienist works on a referral system as well. The dental specialist works on a referral system. Right, but the first line of contact would be the dentist and the dental therapist. And as much as possible, nous pouvons encourager ces lois, venir à l'appointement. Pas espérer un problème grave.
Dernière ou soit par une j'espère, il fait mal. Rolly, you have to report. Clinique là, quand tu peux causer là, ça texte, on dit là, moment quoi exactement. Ou rapport dans la clinique d'abord? Or directement il y a le roof là comme ça?
No. First point of contact is the dentist dans le district.
The district.
Yes, dans le district, présent dans le district, al clinique qui plus proche avec autres. Right? And then from there they take it up accordingly.
If there's need, then they should refer to the yellow roof.
Yes.
Okay. Next question: is it normal to gums bleed a little when I floss, or I am not doing it properly?
Okay, so here again, the patient or the person might be having simple gum inflammation, like I said, the gingivitis. So even there's a little bit of gum inflammation, when you pass the floss, it can bleed from there. So that happens because the brushing is not proper and there's a little bit of your food debris, what we call as plaque. So that is maybe present there and that can cause bleeding. The second reason is if you don't floss properly. Most of the times we see patients jamming the floss right into the too hard into the gums, causing damage.
It's not just too hard, if I may. it can be, you know, you just think, ah, nous allons hygiénique passe dental floss. Parce que ça fait n'importe comment qu'ils ont envie. Il y en a une certaine façon qu'ils ont montré dans la clinique, manière pour faire. And it's good to follow sa education qui peut faire. At some point, you have to do reviews and reiterate.
Refresh.
But it's a question of listening as well. So it's good to practice whatever vous pouvez conseiller aussi.
We have a question from Pralin viewers. Do you do visit on Pralin?
Again, from our unit, we are going to start soon. Yes, the talks are going on, and we are almost in the final phases of planning this for it. Because, like I said, our unit is new, so we have our own limitations.
It's on the table.
It's very much on the table. It's very much on the table.
It's very much on the table pour Kintex. Pas temps seguin, pas ta casser, ben pour monter très bientôt. Alors, se mettre au pareil, very much on the table pour venir this year or next year?
Most probably by end of this year.
By end of this year. So, pas ta casser avant Noël, ben na check pour capable faire si vous les deuils bien organisé, bien pour capable manger un petit peu la viande pour Noël. Seulement, pas temps seguin, ça un texte ya Carole. Bonjour Carole, moi si vous voulez demander, les moments quelque chose dit pareil gros biscuit ou bien croquant, sec, il crosse mon gencive et mon besoin fait un mouth match, soit nettoyer avec de l'eau or cloves for a few days. It's not really a question. Il peut juste dire comme si quoi qu'il sont remarques qui fait l'état, il mange ça quelque chose dit, par exemple, dit gros biscuit, non bon gros biscuit là. On sont des amandes qui nous dit là où s'arrête là. Vous connaissez ça?
Moi des awa. Oui.
Il rit de même.
Yes. Well, we don't advocate for soft diets or anything, but as much as possible, you have to watch what you're eating, because whatever you're eating does have repercussions dans la pousse. Pareil, il y en a quand j'étais, c'est l'oiseau content, si c'est salade de poisson.
Ah, ça mon.
And then we see quand autres mangent ça va
tout ça qu'il a dans nous manger.
Exactly.
We eat everything.
And then when they go and they happily enjoy their bones, pork bones, crackling. Yes, there's always something that you see eventually dans la bouche quoi qu'arriver avec ça. So, manger, you have to watch what you're eating. Of course, nous pas advise, nous pas dire pas manger quelque chose doux. Comment connaît la quantité que vous pouvez manger. Il affecte. Yes. Il affecte la santé en général. Il affecte la santé de la bouche. Right? Il affecte au dental caries, tooth decay, which is one of the wali quantité de mammaille dans la gilles wali quantité. Ici, surtout c'est le wali dans la bouche passion.
Is it because sugar things?
We don't know the cause of it yet, but it's a combination of a lot of things. But the tendency in your diet has changed over the years. It has changed. So it may have a role to play, but we don't know the extent of it. It's a bad change. Yes, having tooth decay is bad because when you have tooth decay and you're not treating it on time, you lose the tooth. When you talk about dentures, everyone says, chi salé de fait fini avec. But it's pas confortable pour rester avec fausse dent. More usually, what I usually tell.
So think of it, you are wearing it.
Yes. I usually tell people, if you know an older person who's wearing a denture, talk to them, ask them, how is it to wear a denture in your mouth? Is it really that good? Is it really, a solution?
It can go off anytime.
Is it a solution to everything? But it is something, it is a treatment that we provide, of course. Right? They have to have a solution to everything. But at the end of the day, as much as possible, we try to keep your teeth. You want to keep.
La viande même, ou acheter la boutique même si vous cuit comme si vous cuit même, it's still red, it's still dit même comme si l'état vous ready, c'est tout. The front teeth là, nous servir à pas dit nous front teeth pour manger quelque chose vous pouvez par exemple biscuit croquant, biscuit bourbon, ça bon biscuit là où ça arrête. Il y a devant il aura bout devant on est.
But just like you learn in school, each tooth has a specific function, right? Your cutting, your chewing is for the back teeth, your cutting is for the front teeth.
Inside, yeah.
So if you're going to use your front teeth to chew or something that when you're supposed to be doing it on your back teeth. Yeah, so, you're not actually using your teeth to the optimal.
As it should be.
Yes.
So, on nous, par le docteur dit, comme si c'est un petit peu responsabilité de nous la bouche. Si poser là-bas derrière, ça qui nous peut manger, mettre l'eau derrière. Si poser l'eau devant, envoyer l'eau devant, c'est pour un petit peu plus de responsabilité, comme ça nous les dents plus bien préservées. The funniest one is that text, mon petit peu imagine là, où tu peux dire dental floss, et il y a des gens qui passent avec dental floss. We are using toothpick, and this text is saying good day to you, and you too, good day aussi. So it's in Creole, I'm translating in. It asks the doctors, what if we are using toothpick? Is it normal?
No. At all.
Several people are using toothpick.
No.
It can cause severe damage to your gums because most of the toothpicks that are manufactured, they have extreme sharp tips there. So you end up poking your gums. What happens is that you continuously use it for a long period of time. Your gums start receding. And then your roots gets exposed, and then you have sensitivity and all lots of problems. That's why when we do the oral health education, we specifically focus on brushing, use of interdental brushes and flosses. Stick to that. That's the safest option. Yes, that's the safest option.
Because the name says toothpick.
It's a misnomer.
It's a misnomer.
It's a misnomer. Yeah.
So, à partir d'aujourd'hui, non, il n'est pas normal pour servir toothpick.
No
Pas
toothpicks.
toothpick, moi, pas pick bonnes affaires. Fromage, l'autre, un petit ananas, ou faire un petit snack avec l'autre, par exemple, aller dedans avec toothpick à partir d'aujourd'hui, comme si des habitués avec sa bonne toothpick, ou des dental floss. Or otherwise,
interdental brushes. You have interdental. These are small brushes which can go between two teeth. Okay. Like you're using a toothpick, this has bristles on the edge of it, and it's very small. So there are different sizes, but it has to be prescribed by us. Okay. By a healthcare professional, it has to be prescribed. You cannot use different sizes because again you will end up damaging your gums. So the right size has to be used. So you see a dentist or one of us as specialists, then we'll prescribe you the right size. We'll examine you, see your gums and the position of your teeth, and then we'll prescribe the right size. So just don't go buy the interdental brushes. No, you can use a dental floss. If you know to use them properly, use a dental floss. That's best. But if you need to use an interdental, you feel there's a lot of food packing and you need to use an interdental brush, come to us, we will prescribe it.
You will prescribe it. What about cleaning?
Cleaning of teeth. Okay, again.
At the clinic.
Again, the thing is that when any patient, when they come for a general checkup, the dentist examines the patient and whatever is required, a treatment plan is formulated. And based on the treatment plan, if the patient has a lot of deposits in the mouth, there's inflammation around the gums, then the dentist refers that patient to the dental hygienist. So they are the ones who does that. When they do the detailed examination and they see that, no, this is much more severe than what is there, then that patient comes to us. And that's when we start our specialist treatment.
So, par exemple, aucune décision des autres même, si vous senti quelque chose pas normal ou remarqué quelque chose pas normal, on connaît les corps, si quelque chose pas normal, it's better to report, la bonne spécialiste, il y a des plus bonnes positions pour dire quoi qu'il peut faire, pour conseiller quoi qu'il peut faire. Et bien sûr, nous avons un petit portrait qui dit nous voulons nous pécoser Lola Christiana. Mais si we have a little photo from Christiana, it's a kind of floss toothpaste she has sent to us, forward us this one. Is this good? She asked if this good.
This is again a type of dental floss which has a handle on it. So some people will have difficulty in the dexterity will be slightly different for them. So for them to place the floss at the posterior teeth and all, it will be difficult. So in those cases, you can these dental flosses with a handle on it. So we do prescribe this to some patients who say that they find it difficult to use the floss in the posterior region, back teeth. We tell them to use.
So it's good.
Yeah, one of the things that you see with these handles is they tend to use the sharp end of it buying a toothpick. Again, if you don't use it the correct way, ou peut gagner tendance qui peut blesser les gencives.
It should be used properly.
Yes, technically, my advice is sharp. Anything sharp will be affecting your gums. And also, we don't really advise for them to use one dental floss on the handle for the entire mouth. So now you're walking around the mouth with bacteria. So you're going to take bacteria from this tooth and you're going to be taking to the other side. So keep changing it while you're flossing. Don't use just the one. Right.
Voilà, ça portrait qui Christiana il envoie pour nous. Christiana, merci beaucoup. Et docteur dit, confirmé, il bon pour servir, but make sure you get the right technique.
Yes.
The technique qui est important, là, si tu comptes les dents concernant, côté dental floss concernant, get it right. Another question said, good morning, Carol and both doctors. What's the good toothpaste to use, please? There are different types of toothpaste, as we know. Shops to shops, we see different type of toothpaste. Is there a good toothpaste?
Toothpaste, as long as it has fluoride in it, because fluoride helps in preventing tooth decay, dental caries, as we call it, tooth decay. So fluoridated toothpaste is fine. All those things about charcoal toothpaste and all.
No.
I don't quite advise it.
It's just what you can say. It's marketing, but
just
basically,
it's not doing anything for your teeth.
Yeah, not something great for your teeth. But every patient, when they buy a toothpaste, they should look at one thing, like what Dr. Prabhisheka said. It should be fluoridated. And one another thing I normally recommend patient is not to use any colored toothpaste. Again, it's an additive. Colored toothpaste are additive. Normal without any colors would be better. But if some people prefer the color in it, it is okay. But better is always when you check for a toothpaste, check whether the toothpaste is fluoridated.
Maybe you can give us one example for our viewers this morning. A good example of toothpaste.
You have the Colgate.
Colgate
is
total. We have Aquafresh, Signal.
Yes, there are a lot of brands.
The brands, it's not about the brand for us. We really,
as long as it's
fluoridated.
Because all other components will be the same. You will have all other components. The only thing is that you should look for is whether it's fluoridated or not.
Yeah, maybe for sensitive teeth, then we tend to advise to use Sensodyne.
Sensodyne.
Yes.
No charcoal, please. Facile le temps ou pour qu'un texte justement, as long as it's a fluoridated toothpaste, it should be good for your teeth. Par le docteur dit, si il est sensitive ou il est sensible, then go for Sensodyne. Si il fluoridated, pas pour n'importe quoi, à cause de qu'ils espèrent advertise, mais faire marketing, qui va pas vraiment faire rien pour nous les dents. More question coming in. Should we wash the mouth after brushing or simply spit?
Simply spit.
Simply spit. That's it.
Yes. Because the longer the fluoridated, because in the toothpaste, like we said, has fluoride, the longer it stays on the tooth, the more protection you can have. So washing after brushing, we don't really advise for it. We try to teach children from a very early to brush and spit.
Keep it like that.
Yes.
Simply spit. Are people with sensitive teeth prone to periodontitis?
Sensitive teeth?
Yes.
Periodontitis.
Prone.
Can it progress to periodontitis? Okay, so the sensitive teeth, again, the causes are multiple reasons are there, multiple causes are there. One of the main cause what we see here in Seychelles is the improper brushing technique. So the patients don't use the right method, and what I've seen is that they use the scrub method here. So you put your brush here and you just scrub like this. Yeah. But it should not be like that.
It's the wrong technique?
It's the wrong technique. It's called the scrub technique. So we don't advise that. What we advocate is the circular motion movement for the teeth. So it goes around in circular motion and you sweep it down. So in the lower also you circular motions, you sweep it up. So you concentrate 3 teeth at a time, and that's how so normally it takes around 4 to 6 minutes to finish brushing.
The 3?
Three teeth at a time. So you concentrate on 3 teeth, circular motion starting from the gums towards the teeth, circular, and then you sweep out. So this is what we advocate. So most of the patient does is they do a scrub technique, and when you do this for a long period of time,
no, you're applying pressure
on, and most of them use hard toothbrushes. That's very important again, what kind of toothbrush you're using. So hard toothbrush with the wrong method for a prolonged period of time. It won't happen over 1 or 2 years. Over 5 to 10 years, the patient will come with all the teeth roots exposed, the enamel is gone, the outer covering of the tooth is gone, and you have something known as class 5 lesions or non-carious lesions. It's not decay, but you have defect there. And this exposes your inner layers of your tooth, like your dentine and your cementum and all, and that's when the patient have sensitivity. So that is one cause. The other cause is like what we said, periodontitis leading to bone loss, the gums going down, and the root getting exposed. So that also can lead to sensitivity. So you should understand what your cause is. Both have treatments. For time being, if you want to treat for sensitivity, you can use a Sensodyne toothpaste.
Voilà, bon peu d'informations. Nous pouvons ramasser la bon matin, ça veut dire il est important pour checker ou ça de premièrement faire si it's not a hard one et check bien ou dentifrice aussi il est important pour et gagne sa technique bien qui moyen ou besoin floss ou qui moyen ou besoin brosse ou les dents il est important. Last question I will take, it's in Creole. Good morning all. Moi nan lapse dans mon palais, il y a les vini qui remède please lapse de palais.
Il dépend à cause, il y en a ça l'abcès. Again, nous pas connaissons s'il y en a douleur. We don't know if the abscess has been caused by something. We don't know why the abscess has come up. S'il y en a abscess, it's just going and coming. Best to report to the doctor, to the dentist. Have a see what's going on, why the abscess is coming up. And then after that, from there, we can take it up. But just knowing, we know but we don't know why it's happening. But the même patient diabète, nous connaissons infections they're very prone to infections in diabetic patients. So, mon papa dit qu'il s'agit de diabète, of course, but
it's best to report.
Yes, it's best to report.
Pour bon spécialiste, il va checker, il va dire. I was saying last question. But I think I should ask this one. I feel I should ask this one. What to remove black scars?
Scars or stains.
Stains.
Maybe they stain.
The text says scars, but it should be stain, I think.
Yeah, so
what to remove?
Staining of teeth again can be of, it can be permanent and it can be temporary also. Permanent is due to certain discoloration that has come into the tooth either when the tooth is dead or you had some medications when you were a child and you have a permanent stain. That, to remove that is slightly difficult, and there are specific ways for that. The temporary stains that you have is from tobacco smoking. You have brown stains all over your teeth. You can see that. Then when you consume excessive caffeine drinks, you can have staining in your teeth. So that actually can be removed. That's when you come to a dentist and we do the cleaning and polishing, you can get rid of the temporary stains. But the permanent one, like I said, you have to find what the cause is and then do the treatment
and then do the treatment. Yeah. I'm saving the best for the last. Very sensitive question. Asking about oral sex. Once you've done oral sex, what is the best treatment to clean it up?
Well,
very sensitive question, but do we have an answer?
I'm not so sure about that.
I wouldn't be this thing, but as much as possible, you have protected sex, right? You have protected sex as much as possible, and you do make sure that you rinse out your mouth, or if you just
rinse it, or there's what's the proper?
You have mouthwashes that you can use, medicated ones, but we don't have any literature that proves that this will prevent any STDs or anything. But not that we've looked into it, but protection.
It's
always,
best that you protection always. Dr. Abhisheka, Dr. Jory, it was an absolute pleasure this morning to have met with you for the first time. We talk on the phone. But absolute pleasure to join me here on the Topik Konversasyon to talk a little bit about la santé la bouche and diabetes. You understand?
Yeah, diabetes.
I hope in the next few coming months you'll learn a little bit more Creole.
Yes, trying.
but not the bad ones. It was an absolute pleasure. Merci beaucoup. I know there's lots of work to do at your office. I will not keep you longer, but do have a nice day today.
Thank you.
Thank you.
Thank you so much. C'est ça, Topik Conversation.